The next session is going to be chaired by Dr. Nikhil Gandasi. So as many of you heard his talk this morning, very interesting talk. Dr. Gandasi is an assistant professor in developmental biology and genetics, focusing on cell metabolism and disorders related to cellular function, contributing to the understanding of metabolic diseases. Dr. Gandasi?
Thank you so much. Thanks for a kind introduction and also allowing me to start the session. So the first presenter is Dr. Sri Sanyal. She is a research scholar at Jawaharlal Nehru University in Delhi. She would be speaking about socio-economic determinants and prevalence of chronic morbidity and in the elderly population, especially in Kolkata. So Dr. Sri Sanyal, if you can take over.
Good afternoon, everyone. Am I audible?
Yes, you're audible. So try to present the slides.
Just a second. Is it visible?
Yes, it is visible. If you can go on to the presentation mode. Yes, now it's working. Sure, it's coming. Please go ahead. Thank
you. So today I'll be discussing my study on socio-economic determinants and prevalence of chronic morbidity and multimorbidity among elderly population in Kolkata. With the decline in fertility rates and increasing life expectancy, the old age population has continuously increased globally. As per World Population Prospect Report, by 2050, 1 in 6 people worldwide would be over 65 years of age, up from 1 to 11 in 2019. As we all know that India is in a demographic transitional phase, experiencing increase in older population. The share of older adults has increased from 5.3% in 1971 to 8.6% in 2011, according to Census of India. Similarly, India is experiencing an epidemiological transition, witnessing a rising burden of non-communicable chronic diseases, leading to low quality of life, high medication adherence, higher dependency, and higher health expenditures. Healthy aging can be defined as a continuous process of optimizing opportunities to maintain and improve physical and mental health, independence, and quality of life throughout the life course. The United Nations Decade of Healthy Aging is a global collaboration aligned with the Sustainable Development Goals to improve the lives of older people as cultivating age-friendly environments, creating integrated and responsive healthcare systems and services, and ensuring access to long-term care and for older people who need it. But the large share of older population has its concerning various health problems with increasing the major health risk factors, that is chronic morbidity and multimorbidity. So what are chronic morbidity and multimorbidity? So the term of chronic morbidity have different definitions according to professional communities. According to Center for Disease Control and Prevention, CDC, chronic diseases are defined broadly as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living or both. On the other hand, National Cancer Institute states a disease or condition that usually lasts for 3 months or longer and may get worse over time. Chronic diseases tend to occur in older adults and can be usually be controlled, not cured properly. The most common types of chronic diseases are cancer, heart disease, stroke, diabetes, and arthritis. According to WHO, chronic diseases that are not passed from person to person. They are of long duration and generally of slow progression. The main 4 types of chronic conditions are cardiovascular disease, cancers, chronic respiratory disease, and diabetes. But the main definition differs according to available data used for the research. The time frame or the reference period deserves special mention where the disease is chronic or not. Multimorbidity can be defined as the presence of 2 or more chronic conditions among any individual over a period of time. So the main objective of my study is to assess the prevalence and socioeconomic determinants of chronic morbidities and multimorbidity among the elderly population in Kolkata. The selection of studies site, I have focused on city of Kolkata in West Bengal state, which is located in the eastern part of India. which is a 300-year-old city spreading along the bank of River Hooghly and has witnessed higher elderly population. It encompasses the area under the jurisdiction of Kolkata Municipal Corporation, that is KMC, which is the area covered by the Kolkata Police. It consists 144 wards covering an area of 200 square kilometer. The area of Kolkata district is under KMC as considered by Census of India. West Bengal itself constitutes 8.5% of the elderly population, which is nearer to the India's national average, that is 8.6. Kolkata is growing much faster, that is 11.76% of the elderly population are there, compared to the other metropolitan cities like Delhi, Mumbai, Chennai, Bangalore, according to the Census of India. Therefore, Kolkata has been selected for my study. This is the demographic characteristics where the total population is 4.49 million and the percentage of the population is 11.8%. Sex ratio is 908. Literacy rate is 86%. Main workers is 8.2. Marginal workers are 11.6. Non-workers are 14.2 according to the Census of India in 2011. The data source and the methodology across cross-sectional survey has been conducted using the random sampling method among the elderly population, that is 60 plus age group in the Kolkata city of West Bengal, which was conducted from April to June 2022. About 300 respondents have been taken into consideration, including 152 males and 148 females. Bivariate analysis and binary logistic regression has been conducted by using data to assess the association between various socio-economic characteristics of chronic morbidities and multimorbidity among the elderly population in Kolkata. The selected chronic conditions that are included are heart disease, diabetes, high blood pressure, arthritis, cholesterol, and thyroid. Taking all the chronic conditions into consideration, 3 categories have been made for multimorbidity, that is no disease, single morbidity, and multimorbidity. So the graph shows the percentage distribution of chronic morbidities and multimorbidity, which where 83.67% of the elderly population are suffering from chronic morbidity, followed by 51% with multimorbidity and 32% with single disease, respectively. Among all the selected chronic conditions, elderly in Kolkata are mostly suffering from hypertension, followed by diabetes and arthritis. Here, the graph shows the prevalence rates of chronic morbidities and multimorbidity according to the various socioeconomic determinants. From the graph, the oldest old, that is 80 plus population, are suffering from chronic conditions, and they also have multimorbidity. Age is a biological factor leading to the deterioration of health in later years, where the body becomes vulnerable and are associated with physical and cognitive impairment. On the other hand, on the next graph, the female elderly population are more prone to the chronic morbidities and multimorbidity compared to the male elderly. Females have a higher, longer life expectancy than male, and aging is associated with increased risk of developing chronic conditions. Also, lack of physical activity, obesity, dietary factors, lower socioeconomic background, and often self-medication are the main reasons for having chronic conditions and multimorbidity. Around 90% and 60% of the elderly who are widowed or divorced are suffering from chronic conditions and multimorbidity. Similarly, for the living arrangement, those who are not living with their spouse and children are suffering from chronic conditions and multimorbidity. Marital status and living arrangement is considered an important indicator where widowhood tremendously affect both men and women elderly and their health and well-being. Marital status, living with family, number of relationships, feeling of belonging, describes interpersonal ties, which improves both physical and mental health. According to the social group, the elderly from general category suffers from chronic conditions and multimorbidity, respectively. 34.78% of the elderly population from SC/ST category suffers from single disease. According to the religion, the others category are at a higher risk of suffering from chronic conditions and multimorbidity, followed by Hindus. It is interesting that the prevalence rate of chronic conditions and multimorbidity among Muslim elderly are lower due to their vulnerable societal position, less treatment-seeking behavior, low income, and dietary options. The place of residence shows that 87% of the elderly population from North Kolkata are suffering from chronic conditions. On the other hand, 55% of the elderly population from South Kolkata have multimorbidity. According to the education, the older population with highest educational background, that is HS and above, are suffering from chronic conditions and multimorbidity. Education helps in better healthcare choices, early detection of diseases, more hospital visits, and proper diagnosis and treatment. According to the monthly household expenditure, about 92% and 66% of the elderly population from the highest monthly household expenditure background, that is rupees 20,000 and above, reported having chronic conditions and multimorbidity respectively. Similarly, older persons from higher income background, that is rupees 20,000 and above, have the same. Almost 85% and 55% of the elderly who self-rated their health as poor have chronic conditions and multimorbidity respectively. Poor self-rated health is associated with higher burden of chronic conditions. Elderly experiencing multiple health problems have more negative perception of their overall health, leading to poor self-rated health reporting. In the next graph, generally, economic independence reduces the likelihood of chronic conditions and multimorbidity. But in Kolkata, the elderly individuals who are economically independent are more likely to seek healthcare facilities for proper diagnosis and treatment, resulting in higher prevalence of diagnosed chronic conditions, which where 86% reported those who are not financially dependent have reported 86.55% elderly have reported chronic conditions. Elderly who are financially dependent are at a greater risk of developing multimorbidity as compared to those who are financially secure. Financial security ensures easy access to healthcare facilities and proper diagnosis. Only 76% and 50% of the elderly have reported suffering from chronic conditions and multimorbidity who ever had a habit of using substances, that is alcohol, smoking, and using tobacco or pan.
Dr. Sri Sanyal?
Yes.
Sorry to interrupt you. I think the time, just if you can wrap it up soon.
Okay, thank you. Okay. Reporting of behavioral characteristics are less with societal stigma. So this is the binary logistic regression model where we can see that with reference to no chronic morbidity, the male elderly population compared to the female elderly, the currently married aged population compared to the not currently married, older persons with middle to secondary education compared to the higher secondary and above educational level are less likely to suffer from chronic morbidity. Similarly, with reference to no disease or single disease, the male older population compared to female old, the elderly with rupees 10,000 to 20,000 monthly household expenditure compared to the 20,000 and above monthly household expenditure, and those who are not financially dependent compared to financially dependent elderly are less likely to suffer from multimorbidity. Additionally, those older population who have self-rated their health as poor are 2.74 times more likely to suffer from the risk of chronic morbidities compared to those who have reported good self-rated health. The odds of having multimorbidity is higher among the elderly population who self-rated their health as poor and ever had a habit of using substances compared to those who have not. So the main findings and the conclusions are indicates that the female old with higher secondary and above educational level and who are not currently married with poor self-rated health are more associated with the prevalence of chronic morbidities. The older females from the higher monthly household expenditure background, that is 20,000 and above, with poor self-rated health, financially dependent and have a history of substance use are more likely to suffer from multimorbidity. Developing primary care clinical practice guidelines on managing individual chronic conditions and multimorbidity is an important component for strengthening the health system and will increase the individual practitioner responsiveness to the challenge. Proper awareness and multimorbidity management programs should be promulgated among the older adults by the state government healthcare policies. Social engagement and support from the social and neighborhood community are crucial in promoting better health and well-being, especially in the later ages. The limitations of the study are that it has the elderly individuals living in Kolkata Municipal Corporation has been only included, who have been diagnosed with 6 chronic morbidities in the last 1 year. The 6 chronic conditions have been constricted to only heart disease, diabetes, hypertension, arthritis, cholesterol, and thyroid, and the data is self-reported. The study did not take into account the impact of specific disease combinations or the severity of specific chronic conditions among the elderly population. The study was conducted during the last phase of COVID-19 pandemic in 2022, which may result into less accessibility of robust information on disease profile of the elderly. The accuracy and reliability of patient-reported information on using substances can be affected by cultural factors such as stigma or taboos surrounding certain behaviors, as well as by the difference in understanding and interpretation of the definitions used to describe these behaviors. Thank you.
Thank you so much for a very interesting talk on socio.
So his video is frozen. But Dr. Sanyal, Sri Sanyal, thank you so much for your talk, and we are looking forward to the questions and everything. Our